Dear students, welcome back. In the previous session we have discussed about hip joint capsule and ligaments. Now in this session we are going to discuss about the weight bearing structure of the hip joint. And if you know this weight bearing structure of the hip joint, you can understand the structural adaptations to weight bearing. Okay, the internal architecture of the pelvis and femur reveals a remarkable interaction between mechanical stresses and also the structural adaptation which are created by transmission of forces between the femur and the pelvis. So here you can find this. So these are the weight transmission. So as we revealed in the vertebral column, that weight transmits along the vertebral column up to the sacroiliac joints. Okay, so half of the weight will transmit to each limb. So here you can find some lines here through which the weight is transmitted to the lower limb through the femur. Okay, so this will we can discuss in detail afterwards. Now the trabeculae, so what we call as this weight bearing lines. Okay, the trabeculae, which are calcified plates of tissue which is seen in cancellous bone. So as we know that if you see the coronal section of the bone, you can find peripheral cortical bone. At the center you can find the cancellous bone. So over this cancellous bone we can find some lines of stress and form some systems which normally adapt to stress requirements. So if you see in this cross section, you can find the trabeculae of femur line up along lines of stress in the cancellous bone and can be seen on this cross section. So here you can find these are the lines of this tissue formed like this along the where the maximum stress is present. You can find some thick lines there. Okay, so this is the trabeculae which are formed in the cancellous bone. Okay, now again we are going to discuss about the weight transmission. So the weight bearing line through the vertebra of the spinal column to the sacral promontory and on through the sacroiliac joints we have discussed in the vertebral column. And most of the weight bearing stresses in the pelvis pass from the sacroiliac joints to the acetabulum. In standing or upright weight bearing activities, at least half of the weight, that is half of the weight of HAT, that is head, arms and trunk, half of the weight passes down through the pelvis to the femoral head. So this is the force which is coming from the upper part of the trunk, that is half of the weight HAT, which is acting at the acetabulum and then it reaches to the femoral head. Okay, yes. Next, whereas the ground reaction force which is traveling up towards the shaft. Okay, these two forces nearly parallel. So these two forces are nearly parallel, okay, and in opposite directions. So if you can see, the HAT force is acting downwards whereas the ground reaction force is acting upwards. Okay, and which creates a force coupled with a momentum equal to the distance between the superimposed body weight on the femoral head and the ground reaction force up the shaft. So here it will create a momentum. So because the force which is coming from this HAT, which is acting on the femoral head, will move like this, and the force which is coming from ground, that is called as ground reaction force. So this is an opposing force when we are standing. So this is the reaction force for this weight. So this is acting upwards. So the force which is acting here is moving upwards. So these forces create, the ground reaction force create some tensile forces like this. So because of these tensile forces causing bending force on the femur, so which causes compression on the medial aspect of the femur. Okay. So the bending stress creates a tensile force on the superior aspect of the femoral neck and a compressive stress on the inferior aspect. A complex set of forces prevents the rotation and resists the shear forces that the force couple causes. Among these forces are the structural resistance of 2 major and 3 minor trabecular systems. Okay, now we are moving to study this medial and lateral trabecular systems. Yes, the medial trabecular system arises from the medial cortex of upper femoral shaft and radiates through the cancellous bone to the cortical bone of the superior aspect of the femoral head. So this is the medial trabecular system. Okay, again we will see the medial trabecular or principal compressive trabecular system arises from the medial cortex of the upper femoral shaft and radiates through the cancellous bone, and this will radiates through the cancellous bone to the cortical bone of the superior aspect of the femoral head. So it is not only present in the cancellous bone, but it is reaching the cortical bone of the superior aspect of the femoral head. Okay, the medial system of trabeculae is oriented along the vertical compressive forces passing through the hip joint. Here you can find this forces which are coming from the acetabulum is first taken over by this medial trabecular system. Okay. Next, coming to the lateral trabecular system of the femur arises from the lateral cortex of the upper femoral shaft. So this lateral trabecular system is coming from the shaft towards the femoral head, but medial compressive system or medial trabecular system is coming from femoral head to the shaft. Why? Because the forces which are coming from HAT is in downward direction, so this medial trabecular system is formed like this, and this lateral trabecular system is mainly caused by this ground reaction force. Okay, so this lateral trabecular system arises from the lateral cortex of the femur, that to upper femoral shaft, and after crossing the medial system it terminates into the inferior aspect of the head of the femur. The lateral trabecular system is oblique and may develop in response to parallel forces of the weight of HAT and the ground reaction force. And also there are two accessory trabecular systems, of which one is considered compressive and other is considered tensile. And another secondary trabecular system is confined to the trochanteric area of the femur. So you can see the trochanteric area of the femur. You'll find some lines here, and here you can find secondary tensile system, which is seen on the upper shaft. Okay, and also you can find this secondary compressive system. Okay, so these are all the trabecular system, how it is formed. Okay, now, so the lateral system is thought to develop in response to forces created during contraction of the abductor muscles and to tensile stresses created by the tendency of the head and neck to bend on the shaft of the body weight arrives on the head of the femur. The two accessory trabecular systems are confined primarily to the trochanteric area and neck of the femur. The medial accessory system arises from the medial aspect of the upper femoral shaft, which crosses the lateral trabecular system, and it fans out into the region of the greater trochanter. The lateral accessory trabecular system runs parallel to the greater trochanter. The areas in which the various trabecular systems within both the pelvis and the femur cross each other at right angles are the areas that offer the greatest resistance to stress and strain. So these are the areas which are having greatest stress and strain. Okay, and there is an area called zone of weakness which has less reinforcement, and they are more prone to injuries. That area is called as zone of weakness. If you see, this zone of weakness normally comes at the neck of the femur. Normal fractures of the femur occurs at this area only, because there is no trabecular system or there in that area, and when you compare with the other parts of the femur, that is the area which is very thin. Okay, so this is about the trabecular system, where all these medial and lateral trabecular systems are present, and also we have discussed about the secondary tensile system and secondary compressive system, and we have also find the zone of weakness area. So in this pic you can see the forces on the medial aspect undergo compressive forces, and on the lateral aspect here you'll have the tensile forces. Okay, so this is about the trabecular system, and there are some studies regarding this trabecular system to know where this primary weight bearing surface of the acetabulum is present and when it is having peak responses. In that study, the primary weight bearing surface of the acetabulum is the dome of the acetabulum. Normally at the dome of the acetabulum, it is having a more trabeculae in the pelvis. So here you can find, yes, this is the trabeculae, that is called as primary weight bearing area, which is located on the superior portion of the lunate surface. In the normal hip, the dome lies directly over the center of rotation of the femoral head. If you stand in unilateral stance, okay, then it is found that peak contact pressures during unilateral stance can be observed at this area. Okay, and in the contact area in the females is significantly smaller in females than in men, with associated high peak contact forces. So although the area, that is the contact area, in women is specifically smaller when compared to men, but it is having high peak contact force. Why? Because if you see the angle of inclination when compared to men and female, due to the orientation of the pelvis, the female angle of inclination is less when compared to men. So if the angle of inclination is less, there is a chance of more contact with that of acetabulum. Okay, that means more coverage of the femoral head can be observed. So because of the coverage of the acetabulum, so we are getting higher peak contact forces in females. Normally, the full loading of the hip joint is necessary to achieve congruence and also optimize load distribution between the larger femoral head and the acetabulum, and it is mainly useful for exchange of fluid to maintain cartilage nutrition. So this is all about the trabecular system and also the weight bearing structure of the hip joint. In the next session we are going to discuss about the function of the hip joint, which includes orthokinematics and osteokinematics of the hip joint. Thank you.